Hello, everyone. My name is Ebelechwuku Tabugbo, and this is my presentation on vaccinating against COVID-19. Will it be a problem? I'm going to be introducing the topic of the coronavirus, the different type of vaccination we have presently, and also the clinical trial and the vaccination distribution, along with a timeline of the progression of the coronavirus in the United States. And during the year 2019, the whole world was struck by the global pandemic called coronavirus. And according to the World Health Organization, the rapid spread of the virus around the world became more contagious, leading them to declare COVID-19, which is the name they gave it, a pandemic. Although the transmission of the coronavirus from animals to humans is rare, this new strain likely came from bats, and through one study suggests pangolins are the original animals that were infected by the coronavirus. And the source is Candola ND. Pangolins are animals that are related to the armadillo and the anthid family, and these animals are scaly mammals that feed on burrow insects such as ants and termites. And although these animals are protected by the animal law in China, this animal was still sold illegally in the market for meat, and which was the cause of the strain of the coronavirus. Although during the year 2019, the vaccination and the cure for the coronavirus were not into effect, companies such as Johnson & Johnson, Pfizer, AstraZeneca, and Moderna were in their late stage of finding the cure. And in current time, in the year 2021, which we are right now, companies such as Johnson & Johnson, Pfizer, and Moderna have already found a cure for the coronavirus and the vaccination for the virus. Pfizer was the first company to actually get recommended and approved to give the virus in the UK. So I'm going to be talking about the Pfizer vaccination and the type of vaccination it is. The Pfizer vaccination is given 2 shots 21 days apart and is recommended for people who are 16 years and older, and the vaccination is an mRNA vaccination and is safe for women who are nursing. The Pfizer BioNTech COVID-19 vaccine is a diluent 0.9 sodium chloride, which is a normal saline and is preservative-free, and this source can be found at COVID-19 and Your Health 2020. The vaccine can be stored at a temperature from 2 to 8 degrees Celsius, which is a deep freeze, and the effect of the vaccination are chills, tiredness, headaches throughout the body, pain and swelling, and redness in the arm where the vaccination is given. Even though the second dose of the vaccination does not necessarily have some of the symptoms present, within 7 days of the vaccination, some of the symptoms begin to show. The next vaccination I'm going to be talking about is the Johnson & Johnson vaccination. And the Johnson & Johnson vaccination is the only COVID-19 vaccine so far that is given with a single dose. Moderna and Pfizer requires 2 doses, and just like the Moderna vaccination, the Johnson & Johnson vaccination can be stored at a regular temperature. And this does not require the deep freeze like the Pfizer vaccination, and the source is Christine 2021. And the Johnson & Johnson vaccination is what is known as a non-replicating viral vector vaccine. And this vaccine is using a common cold virus called adenovirus 26. And after the distribution and the effectiveness test of the Johnson & Johnson vaccination, the US already ordered 100 million of the dose of the vaccination from the company and is waiting to get tested around the year 2019 by the CDC to get approval to be distributed and manufactured all around the United States. And as of current time, the CDC already approved the vaccination and is already getting distributed all around the United States. And also, the Johnson & Johnson vaccination is also effective against moderate and severe disease ranging from countries such as the United States, Latin America, and South Africa, where the new strand of the coronavirus variants were discovered. And also, this source can be found at Christine 2021. The next vaccination I'm going to be talking about is the Moderna vaccination. And the Moderna is given 28 days apart and is recommended for people who are of 18 years and older. And the vaccination, just like the Pfizer vaccination, is an mRNA vaccination and is also safe for women who are nursing. The Moderna vaccination is 94.1% effective in preventing laboratory-confirmed COVID-19 illness in people who have already received the 2 dose of the vaccination and have no evidence of being infected previously. And this source can be found at COVID-19 and Your Health 2020. The side effects, just like the Pfizer vaccination, are chills, tiredness, and headaches throughout the body, pain, swelling, and redness in the arm where the vaccination is given. Amongst people who participated in the clinical trials, 22.3% have at least one high-risk condition, and those high-risk conditions include lung disease, heart disease, obesity, diabetes, liver disease, and also HIV infections. Around those high-risk conditions, 4% of those participants in the clinical trial had 2 or more high-risk conditions. So the next thing I'm going to be talking about is the clinical trial. And according to the CDC, this trial happened between the Pfizer and the Moderna vaccination. And these are the individuals that participated in testing the coronavirus vaccine. And this is the different type of ethnic groups. For the Pfizer and the Moderna vaccination, the white community had 81.9%, and for the Moderna, 9.4%. The Hispanic community had 26.2%, and for the Moderna, 20%. For the African American community, they had 9.8%, and for the Moderna, 9.7%. For the Asian company, 4.4%, and for the Moderna, 4.7%. And any other ethnic groups that were tested had less than 3%, which is the similarities between these two clinical trials. And for the male group were 50.6% for the Pfizer, and for the Moderna, 52.6%. For the female group is 49.4% for the Pfizer, and for the Moderna is 47.4%. For people who are 65 years and older, which is the recommended age group to get the vaccination first, were 21.4% for the Pfizer vaccination, and for the Moderna, 25.3%, which the Moderna had a higher percent rate than the Pfizer vaccination. So next, I'm going to be talking about the vaccine distribution. And from the former administration of the Trump presidency, they promised 100 million vaccination during January of the year 2020. Well, when it is figured out from the current presidency, the Biden administration, they promised 100 million vaccine in their first 100 days of their presidency. And upon further review from the other administration of the Trump presidency, they only found out that there were no second doses of the vaccination to give, because all the first dose, all the manufactured dose of the COVID-19 vaccination around that time were the only dose set that they had. And this source can be gotten from St. Johns Hopkins 2021. And the Biden administration has already announced his American Rescue Plan, which is a 1.9 trillion emergency relative package to fund the vaccination of the COVID-19. That could also change the course of the pandemic, but also help families who are suffering from the pandemic. And is also going to lead to an economic and racial justice relief. People who are in senior homes, according to the Biden administration, and healthcare workers were the first to receive the vaccination. And as of December 30th, only 2.6 Americans received the vaccination, not the 20 million that was promised to be vaccinated, which they surpassed with 6 million. So now I'm going to be talking about the timeline of the coronavirus in the United States. And as of January 2020, the coronavirus case was reported in the United States from a man in Washington, D.C. And also during that year, President Trump restricted travels to China and also issued a 14-day quarantine. And also, as of February 2020, the Grand Princess cruise that was shipped coming from Japan was quarantined and stopped because someone tested positive. All the crew tested positive for the coronavirus. And also during February, a woman in San Francisco became the first in the United States to die from the coronavirus. The US already issued around February a do not travel from South Korea and Italy, where the outbreak became severe and they had a highest number of deaths from the coronavirus. And as of March, the passengers, like I said before, from the Grand Princess crew tested positive in Oakland, California, in a military base where they were quarantined coming from Japan. And as of March 2020, the World Health Organization already issued the coronavirus, based on my introduction, a global pandemic. And also the governor of New York, Andrew Cuomo, already implemented a 1-mile radius containment area in New York, in New Rochelle, New York, where they had an outbreak of the coronavirus. And also during March 2020, the coronavirus outbreak in the United States grew severe and prompting the authorities to erect field hospitals and use refrigeration trucks as temporary morgues because of the constant deaths and people who were getting administered into hospitals, and the capacity kept going stronger and there were no more capacity they could take. They started inventing and started erecting field hospitals outside to contain and help relieve the stress of the hospitals and people who were dying from the COVID-19. And also, as of March 2020, many workplace and school were closed and they were also switched to virtual learnings, and many large events were canceled, and also officials urged Americans to stay at home. And that is where the worldwide United States, especially in New York, that was where the lockdown was initiated. And also, based on my other distribution of the coronavirus, the Congress passed a historic $2 trillion economic stimulus bill, and the Biden administration had the second highest $1.9 trillion emergency fund for the COVID-19 relief. And also partaking to that, the Biden administration has also issued a distribution of the vaccination to different states, and it's also left up to the state governors and the state mayors to discuss on how the distribution of the coronavirus vaccine to be distributed to the public. And also, as of March 2020, a White House coronavirus task force estimated that the deaths toll in the United States could reach up to 100,000 to 240,000 in the United States. And as of April 2020, the CDC recommended all Americans wear cloth masks in publics, and also the deaths in the United States surpassed 20,000, marking the most fatal in the whole world. And there are also many more facts to come about the coronavirus, and also such many facts can also be found in the CDC database. And thank you so much for listening to my presentation, and hope you have a good day. Thank you.